So I want you to all give a warm welcome to Dr. Jerry Callaway.
I'm Jerry. I'm an alcoholic and addict.
Hi, Jerry.
Clean and sober date is October 10th, 1980. I'm very old. Thank you. Any of you that are new in recovery, welcome home with all my heart. And especially since you found this wonderful organization that I've always found. You guys are so incredibly up. I do have to warn you, though, that in 4 decades in recovery, nothing has turned out as I planned. I wanted to be famous. Instead, I ended up anonymous. And it was the best thing that ever happened. So much of my life has not been planned. I was board certified in internal medicine and knew absolutely nothing about this disease after 24 years of education. I share office space now with an addiction psychiatrist, and he says the two of us are educated far beyond our level of intelligence. Yeah, I volunteered to serve in the Navy after I finished my training, and my first duty section, thank you. I loved it, but my higher power's sense of humor kicked in. My first duty station for 3 months before I went overseas just happened to be one of their 2 treatment programs in the entire world at the time. And they started teaching me about the biochemistry and genetics and psychodynamics of this disease. And I was fascinated. I didn't see how it fit me, of course. Because their definition was persistence in the face of adverse consequences. And I hadn't had any yet. And it wasn't until I got a sponsor that I learned that the word "yet" is actually an abbreviation for "you're eligible too." I've had wonderful teachers. I have been so blessed on this journey. I'm one of the 6 ASAM certified addiction medicine specialists out of about 10,000 physicians in Santa Clara County. I have a prejudice that the only people that do really, really well in the addiction field are people that have been there. Because the scientists, they can understand to a certain level, but there's a level of understanding I share with you that is absolutely unique. You're my family. You're more than patients for me. I'm going to give you some background on addictions because I imagine there's varying level of education and times in recovery, and it's a disease that we're learning more about all the time. It is the most lethal disease I know of in all internal medicine. It's the only disease with a 100% death rate untreated. No cancer approaches that. When I had cancer 25 years ago and I had a 50% chance to live 5 years, my sponsor, Don, pointed out to me, that's better odds than you had with addiction. Yeah. Everything's turning out to be molecular genetics. The cancer I had 25 years ago, my cousin Carol in Tucson had the same cancer the same week I did. Identical in every single way. Addiction is the most powerful gene we deal with, far more powerful than diabetes. Addiction is a lethal genetic metabolic brain disease. And the first time I heard someone say they were a grateful alcoholic or addict, I thought they'd lost their mind. And now I understand. Because to survive this disease, you have to end up happier than you've ever been. And I know that's a horrible price. But if you're here and are willing to pay that, I will tell you that every one of the steps is written we, not I. I could not have learned to live in any of the 12 steps without the men who sponsored me. I can still remember my first meeting vividly. And I was a periodic, and periodics, people that use things periodically have the illusion of control because I could stop. It wasn't until I got a sponsor and he said, yeah, Jerry, but can you stay stopped? I hadn't considered that question. The basic science of this disease is just fascinating. Only 15% of the population appears to have the addictive gene worldwide. I think we more than make up in trouble for our small numbers. Once a gene appears on one side of a family, 70% of the people in the family will have it and will activate it by their 20s, even if they're adopted at birth into a non-drinking, non-using family. It's that powerful. And remember how the founders, the doctor and the businessman 90 years ago said we're different than our fellows? And they knew nothing about molecular genetics or brain neurochemistry, but everything they said has turned out to be right. We are truly different. NIDA 2 years ago reported, it's not just us that say it, our IQs are not merely high, they're above 140 generally. And I think that's a blessing and a curse, because you may have experienced not being able to shut this damn thing off. The real key to understanding the disease, and when they said that alcohol and drugs are the symptom of the disease, that's one of the most interesting statements. It turns out the real disease is endorphins. People in our society know about them because they know about a runner's high, but the reality is we'll never experience anything nice without endorphins being released. Laughter releases endorphins, lovemaking, eating a large meal, having something nice happen to my grandkids. Anything pleasant is going to release endorphins. Conversely, any stresses in your life, any kind of physical pain or emotional pain, fear, worry, boredom, anxiety, frustration, resentment, any sort of stress is going to lower your endorphins. So those of you who are new here, I advise you to cut all stresses out of your life immediately. It turns out at birth, we actually have lower than normal endorphin levels in our brains at birth before anything even ever happens. And we think trauma is the initiator, that one of the things that sets off the road into this addiction, because no one ever intends to become addicted. I've never met anyone, I wanted to be a doctor, have a family, be addicted. I don't remember that one. In our society, I think it's more unusual for someone to not activate it than to activate it. The average age where people make a decision to drink or not drink is now down to 10 and a half. I can still remember seeing the 12 steps and thinking I don't relate to those things at all. They don't have any relevance to my life. Now they're the answer to every single thing that happens. Because I didn't feel addicted. And the reason no one ever feels addicted is where the damn receptors are. And that's what finally made sense to me about why the disease is so lethal. We operate out of our cerebral cortexes. Right brain and left brain. Left brain is, mathematical, analytical, logic. And that part doesn't seem to be hit really hard by marijuana. Right brain, visual spatial relationships, recent memory, creativity, those things are really hit. So people can appear functional and they appear engaged, but they aren't. The receptors for the disease that we've been able to identify, none of them are in the cortex. They're all in the ventral tegmental area, the nucleus accumbens. So the subconscious, the part of the brain that most of us have no access to. I certainly wouldn't have picked any of the dreams I had in the last week if I had any control over that part of the brain. As my wife's going through a health issue, and I am truly powerless. Fortunately, I know what to do with powerlessness. In addiction medicine, I don't even care anymore what someone comes in behind what they were using. Because it turns out there's only one pathway. I don't know if you may have seen this already. This could be interesting. Ethyl alcohol, one of my old friends. Written history goes back to 7000 BC with the Sumerians distilling poppy wine. Okay. I tend to be soft-spoken anyway. Written history goes back to 7000 BC with the Sumerians distilling poppy wine, which is one of the illustrations that alcohol is actually an opiate. 40 years ago, we knew that people that had the addictive gene would end up with things like 2,3-butanediol in the bloodstream. A couple of biochemists got to wonder, what is it that gets into the brain? That's why I drank alcohol instead of lemonade, was to change how I felt. And it turns out alcohol complexes with dopamine to produce an artificial endorphin. Tetrahydropapaverline, one of the tetrahydroquinones. Oops. You'll need to memorize that. There's going to be a short quiz later on this afternoon. One pathway. You can get into it a variety of different ways. Alcohol, we recognize this stuff. It was the second step in the breakdown heroin. Sedative hypnotics. I'm just like my friend Dr. Paul, who wrote the section on acceptance. Part of my story is alcohol, and another part is non-habit forming marijuana. And I never took a single pill that wasn't medically indicated at the time for a symptom that I had at the time or one that I felt coming on. And they were always prescribed and dispensed by a physician. Usually with alcohol. It's a miracle I'm alive. It's hard to kill people with any of these single agents. But as soon as you mix things together, all bets are off. I mean, 0.3 to 0.4 is theoretically lethal with alcohol. I had someone drive to my office one morning with 0.432. I saw a young woman in the ER that thoroughly freaked them out 20 years ago. They drew blood again from the other arm because they couldn't believe they had someone who was still breathing and even talking to them a little bit with a 0.782. We are all genetically less predisposed to hangovers. And that's part of our gene. I want you to have some of the basic science because the reason I talked about this in treatment programs is I want people to feel welcome everywhere. I can identify myself as an addict, alcoholic, and I was trained even in the training I had, it was that there's outer level addictions, alcohol and drugs, and those have honestly been fairly easy for me. I know how to get through major surgery without taking pain meds. There's a lot of tricks, and I'd be happy to help anyone that's dealing with chronic pain or facing surgery. I know a lot of tricks. And one of the things I'm going to put up before I end is my cell phone number and my email address. And I'd be happy to be available at any time. That's why God left me on the planet, is to be of some use. 6 years ago today, I weighed 99 pounds. I really shouldn't be anywhere. And that turned around, like my cancer, somewhat miraculously. The root of all addictions is codependency. Thank you. I get on my knees every morning and say a prayer of gratitude and a prayer to be useful. Because I figure I'm here for a reason. It's funny, I thought happiness would be a goal in life. I'm happiest when I get out of myself and help someone else. It's a byproduct, it's not a goal. And I've got a job that allows me to do that every day. Being so ill for that entire year, it didn't seem like a good idea at the time. But there's a spiritual axiom that life is lived forward and understood backward. It got me out of the job that was killing me. I worked 7 days a week for 40 years. I had a $22,000 a month overhead. Now I have an overhead of less than $2,000, and I work only in addiction medicine, so where my heart is at home, I don't know what's good or bad anymore. Because the bad things have caused me to change in ways I would have never changed. And the support we have on this journey is unlike anyone in the world. I mean, we can go to almost any city in the world and instantly have family there that's for us. My wife, Sheila's a little more of a newcomer. She only has 40 years in recovery. But I've tried to encourage her, and I've taken her to meetings in Athens and Amsterdam and London, and Ireland and Toronto and Banff and all over the United States. And we instantly have a family like you. Codependency, I was taught, is the root of all addictions. Questionnaire that 41 years ago, it's a little hard to define, you know, but there's a really nice questionnaire that someone handed me that helped a lot. I can still remember vividly, it was a topic of a meeting. You know, just like I remember my first meeting. I can't remember what I ate for dinner 2 weeks ago. But I can remember, you know, not getting picked for a team when I was 13, and that's 64 years ago. First time I remembered, the tears came up. The subconscious is timeless. That's why the fourth and fifth step is so critical, because we have to get rid of things that are affecting our endorphins today. You know, I think the steps are divinely inspired because they address what our basic biochemical deficit is. The really fascinating thing is that a study done 40 years ago, where they tapped into the back of people's brains before and after a meeting, they found out we have a rise in our endorphin levels after 12-step meetings. Wow. You know, addressing the basic biochemical problem that we present with. My problem is I still chew up my endorphins with my damn thinking. My friend Paul Oliger, who was an internist in Southern California, who wrote the section on acceptance, always said it never was his drinking or his using, it was his thinking. And he took age 20 questions from Johns Hopkins University. Some of you have probably already done this. You take the questionnaire and switch the word drink to think. It's a really interesting questionnaire. Instead of do you drink alone, do you think alone? Do you think to escape from worries or troubles? Have you lost time from sleep due to thinking? Well, not since 4 a.m. this morning. Have you a complete loss of memory as a result of your thinking? And my two favorites, do you envy people who can think without getting into trouble? And have you tried to stop thinking for a few days but been unsuccessful? If you can answer 3 or more yes, you may have a problem with thinking. And you're in with exactly the right group to teach you how to cure that. You know, I still laugh when I think about how far off the beam I was. I can remember looking at the 12 steps and thinking, where's the one where they make amends to me? I clearly did not get the concepts, and I never would have if it wasn't for the men who sponsored me. I can never repay them. If you're new here and you haven't found a sponsor yet, I think you're in a room full of people. This would be what we call in the military a target-rich environment. I was trained in the model of the outer level addictions of alcohol and drugs, and their synthesis. They're all together. We keep discovering new things that are addictive, new drugs. You know, ketamine, the hallucinogens. They think that's a wonderful idea, just like they did opiates at the beginning of the 2000s. And there's been a 54% increase in ER visits since they started using those damn things. And my wife has had the experience of managing the ketamine withdrawals, which she said is, in the patients, it's just a nightmare. I haven't run into one of those yet. The inner level addictions are even more interesting. And the scientists in addiction medicine don't believe in them because they can't trace it to a specific chemical. But if you think of it in terms of endorphins, if you think of it in terms of persistence in the face of adverse consequences, the inner level addictions are food, sex, tobacco, work, spending money, and gambling, which tie in with the core issues of self-esteem. Personally, I thought 4 out of 6 isn't bad. My friend Father Tom Weston in Berkeley says that in Berkeley they think that people that aren't in at least 3 12-step programs are still in denial. And the longer you're in this program, the more likely you're going to run into opportunities to deal with the inner level ones. Work is the G-rated addiction. You get praised in our society for that one, even if it destroys your family. Food is the toughest of all addictions to me. I have to deal with it every damn day. And a woman PhD did her postdoctoral work on what are the neurotransmitter and endorphin precursors in different foods. because I don't want the same food all the time. It turns out it's a window into the subconscious. When I'm really tired, I'm looking for endorphin, serotonin precursors, things like bread and mashed potatoes and vanilla ice cream. And when I'm back into fear, I'm generally looking for chocolate, which just happens to contain theobromine, an endorphin precursor. And she came up with these tables that you can look at. If the food you're craving, what's the underlying stress? It's really interesting. The codependency questionnaire that I was given, it was so funny because I was thinking, why am I even here? My life looks really good, on the outside. And it was another 20 questions, and alcohol wasn't even listed in it, or marijuana. It was, do you constantly seek approval and affirmation? And I'm generally a people pleaser. Are you your own worst critic? Do you overextend yourself? Have you had problems with your own compulsive behavior? Are you a worrier? Do you feel more alive in the midst of a crisis? Do you isolate? I think the real disease of addiction is about isolation, and recovery is about connection. Yeah. If we stay connected, we can get through everything. I isolated at 10 years of recovery when my first sponsor went out drinking and using, and I didn't get a new one, and I started to isolate more and more. I don't have to drink or use anything to screw up my life. All I need to do is isolate and follow what this thing suggests. We can offer healthy advice to other people, is my experience, almost from your first day in the program. My experience is don't ever trust this thing. Because I ended up suicidal at home with the 357 Magnum. If my family hadn't come home unexpectedly, I wouldn't be here with you today. And I've never gotten that depressed again. In the next year, when I went through an entire year of brain surgeries on my son, a year after that, when I fell on an icy road and stood up and thought I'll go on a hike anyway, and I took a step and the foot separated from the leg, got taken out the entire ankle joint. And that was embarrassing because I was on crutches, non-weight bearing for 4.5 months, and people knew I do all kinds of high-risk things, rappel into caverns and class 5 river trips, and they would ask me what happened, and I had to tell them I fell down while walking. A very humbling journey. So that questionnaire is really interesting, and that's why we all get to do some childhood work sooner or later. Because there's a really sensitive, nice kid in each of us who needs protection and needs support. A whole bunch of people with long-term sobriety have hunted me down because I started in ACA Al-Anon 41 years ago, and I'm suddenly sponsoring a bunch of guys with over 30 years in recovery in ACA. We get to keep growing and we get to keep learning. Marijuana just gets more and more interesting all the time. It turned out to be, in my experience, what I'm doing in addiction medicine is the most dangerous drug in the world. There's nothing else that comes in even close. Decades ago, I started seeing people that were only marijuana users. That's relatively rare. If I polled the entire room, there would be some of you that only used marijuana, but almost everybody would have had a drink in their life, or a pill, or a stimulant. People that are deficient in metencathlins are attracted to stimulants. I'm clearly not. I tried one once to study, and I couldn't even sit down for 15 hours. And I thought, I'm deficient in beta endorphins. That's why I'm attracted to marijuana, alcohol, tranquilizers. The people that are deficient in metencathlins are attracted to stimulants. The people that are deficient in both types of endorphin are attracted to all of them. What was unique about the people that used marijuana alone, I started to realize they had signs of cirrhosis, having never taken a drink. Pills are the second leading cause of liver transplants in the United States. But the Navy taught me how to actually measure livers. It turns out it's the simplest thing in the world to do, because our lungs are hollow and our liver's solid. And once I found the upper end, I'll have people breathe, and I can mark where the lower end is. And then I have this incredible scientific instrument that the U.S. Navy gave me. And your liver size is proportional to your size. Someone 5 feet tall is not going to have the same size liver as a 7-footer. 5 feet, the normal is 10 centimeters. My personal record is 35 years ago, a 5'2" female who had a 25 centimeter liver went all the way into her pelvis, and she survived. Because the way damage occurs, doesn't matter how we take things, they get into the bloodstream. Whether we smoke them, put them on a patch, swallow them, inject them, they all go through the liver and bump off liver cells. And the body comes along and stuffs fat cells in where our liver cells were, on a microscopic scale, smaller than the point of a pin, but it adds up over time. And the problem is that the only symptoms you get from liver damage are fatigue and depression.
Wow.
And that's why antidepressants don't work to cure liver disease.
Right.
People are still using, they don't seem to get a lot of benefit from antidepressants because they're trying to overcome a physiologic process. The neat thing is the liver is the only tissue in the body that can heal. The fat cells can go back to normal liver cells if we just leave the poor damn liver alone over about a year. It starts to heal after 3 months. And you can watch people getting younger. It is just amazing. They'll get younger for an entire year. Look at someone's face the very first day they come into treatment or into a meeting, and look at them in just a week. First the poisons start to clear out. But then after 3 months, the fat cells start going back to normal liver cells. The heart, the kidneys, they don't do that. If we damage those things, that damage is permanent. And that's where things like meth come in, creating that kind of damage. We've started to realize we need to be worried about marijuana only this last year in terms of atherosclerotic cardiovascular disease. That's still the #1 cause of death in American males, even after COVID, even if you added the next couple of causes of death, including things like cancer. ASCVD is still #1 from especially males, and women are catching up. It turns out that if you've been using marijuana, the anesthesiologist is going to be really interested in you, because if he doesn't know that, your chance of having a heart attack is 5 times higher than anybody else. If you've used it within an hour of surgery, it's 8 times higher than anybody else. And we've known nicotine does cardiovascular damage, leads to heart attacks and strokes. We didn't realize that marijuana did it. Significant increase in strokes. And atrial fib, I don't know if you've encountered relatives with atrial fib. It's an irregular heart rhythm where your upper chambers are beating about 300 times a minute and are not syncing up anymore with the lower chambers. And so the rhythm is kind of chaotic. And you lose about 15% of your efficiency, which doesn't sound like a lot until you realize that that's 24 hours a day. You're, just being alive is more taxing. And the incidence of atrial fib is dramatically increased with marijuana. We didn't realize that. I had the experience of talking to the docs in Colorado at the American Society of Addiction Medicine meetings in 2015. They'd already legalized marijuana, and they predicted what was going to happen to us, and they were right on. 10% increase in auto accidents every year, increased psych admissions, increased ER admissions, especially with the more potent marijuana, the hyperemesis syndrome, where they keep coming in, I guess thinking that this time it's not going to do it again. And very, very difficult to treat. Topical capsaicin helps a little bit. IV Zofran doesn't reverse it, and it works for chemotherapy, but it won't work for the intractable nausea and vomiting secondary to marijuana. The increased suicides. The one interesting statistic, yes? was that I thought clearly was marijuana. There was a dramatic increase after legalization of marijuana of people lost in the Denver airport that couldn't find their airplane. Yep, marijuana. Marijuana doesn't tend to cause lung cancer. That's been pretty well studied, but it does associate with squamous cell cancer of the neck, the head and neck, which is another nasty cancer. Abnormal brain scans, common in marijuana use. Liver damage. And the one unique thing that marijuana does that no other drug does is immune system damage. the American College of Physicians just came out with the most academic internal medicine group in the world with recommendations about marijuana, and a lot of them made sense to me. The one that didn't make sense is they recommended more research. The reality is the research has all been done, but it's not on the internet. This is an article from the Journal of Addictive Diseases going back in the early 90s, and it's summarizing all of these different studies that have been going on for 20 years before that about the effects of marijuana and immunity. We knew about this long ago, but it's like the medical profession is just starting to realize it now. Oh, you mean it affects the immune system? Yeah. The problem with the medical literature is it's unreadable. I think you literally have to fail English 1A in order to get published in the medical literature. Listen to this run-on sentence. The transformation of B cells stimulated by the mitogen LPS was inhibited more than were T cells stimulated by PHA following the same doses of THC in mice. Klein et al. 1985, this evidence of diminished B-cell reactivity following the administration of THC was confirmed in another study, Munson et al. 1976, that showed a dose-dependent suppression from doses of 50, 100, and 200 milligrams per kilogram of THC in mice. These doses are enormous, of course. That was the only sentence that made any sense. I'm board certified in internal medicine. I had to read this thing about a half dozen times to realize they're talking about marijuana not only hits B cells that make antibodies, but hits T cells that are our memory cells. And I don't take care of mice. But after reading this, a kid came in. His parents realized he was in a private school. His grade point had dropped significantly. And they did a urine drug screen, and what a surprise, there was marijuana there, THC. It turns out there's actually 28 different cannabinoids. Delta-9 is the most psychoactive. Unfortunately, when they've hybridized it for that, we don't know what they've changed in the other hundreds of different chemicals, but something does a marvelous job of attacking the immune system. This kid had a sinus infection, and films show he had air fluid levels in 4 out of his 8 sinuses. So I put him on antibiotics, but I also, because of this article, drew quantitative immunoglobulins by immunodiffusion, which isn't a test I would ordinarily order. It tells you what your gamma globulin level is, the IgA, the secretory one, and the IgM, which is the one that handles viruses and tissue transplants. IgG is supposed to be over 1,500. His with an infection was 0. 6 months later, I drew it again. He was over 1,500. 6 months after that, he had relapsed, so I thought, draw it again. His gamma globulin level was back to 0.
Wow.
That's a major thing that activates the white cells in our system, if something's going on. And marijuana does that uniquely. Back in the days when AIDS was so devastating, before we had the protease inhibitors, marijuana was actually, in addition to IV drug use, was probably another risk factor for developing AIDS, and we never realized that.
Wow.
So this kind of clinical information hopefully is going to get more out there. I've done a lot of teaching over the years. I've taught in the departments of medicine and psychiatry at Stanford. I still teach internal medicine residents. I've taught in the family practice program. And they're getting training actually while they're still in medical school. I didn't even have an hour in 24 years. For a disease that is just when Harvard did a study, and they have 5 general hospitals. When they included smoking as an addiction, 85% of their inpatient and outpatient services were being utilized by people with addictions. And unfortunately, we've addressed it by trying to develop address the symptoms. We'll address your liver disease, not your emotional and spiritual illness. That's what you do that the medical profession will never be able to do. They will want to, but their understanding of this disease is still locked in on the level of neuroanatomy. We've all lived it. How am I doing on time? Because I got a little bit. One of the things I wanted to do was to answer questions, because this is an opportunity. And I'm going to put up my cell phone number and my email address so that I'll be available going forward also. I've got some other material I would want to present, but any questions, because this is your opportunity to pick on the medical profession. Yes.
So I'm Jeff. Hi, how are you?
Hi, Jeff.
So, question I have is there been any studies showing, like, you know, somebody, I guess my question is, like, anybody who smokes marijuana is going to have, obviously, the chemical, all that stuff going on. Has there been any studies that show, like, that the addiction, the ability to, what was that? Oh, that's a microphone? Oh, okay. It's like a favorite. So the question is, so like if I don't know, I have a 13-year-old daughter, okay, she's 18. She told me the other day she started smoking pot when she was 13. And she's on antidepressant right now. She went to college and she freaked out, and now she's back home. So I'm just seeing a lot of behaviors, but I'm just curious, like, is there any studies that show, like, that is it just everybody's going to be addicted to this stuff, or is it some people can use it, or like, you know, they say about alcohol, some people can have a drink and then no big deal. Is it the same with cannabis, or is there a higher?
It's molecular genetics. Again, if it's in your family on either side, there's a 70% chance she has a gene. And the problem is, if she started using before age 15, the New Zealand study showed that the people with developing brains get hit even harder. And people have said they've used marijuana for anxiety. It turns out more commonly causes anxiety. You know, and abilities to cope with stress. You know, it takes away the right brain. You know, the ability to abstract and conceptualize, you know, things that you would really need for some kind of academic learning. Fortunately, there's a lot of healing. There's something called neuroplasticity, where the brain can heal. Even people with strokes seem to come back. You know, if you're incredibly weak on one side and a facial droop, I've seen those people resume ability to walk, and only when they get exhausted, you can see the facial droop again. Yeah. Because people have recovered. I would want her to look at maybe some help, because this is intensely suspicious for the gene running through in the family. Because adverse consequences. A bunch of questions, yes.
When my experience has been when I smoke, I
Can't hear you.
When you smoke,
when I smoke, I can't do math to save my life, but I'm very creative, so it seems like it switches. It's the
yeah.
opposite.
What it's interesting is your inhibitions go down, your creativity actually decreases, but your inhibitions are lowered. That's been studied, right? And creativity is your right brain. I took care of a very famous rock star who just apparently retired recently. And he's been through treatment a couple of times. I sent him to his first treatment program, and he thought he was more creative. And that's been really studied. Neuropsych testing is testing of brain function. And globally, it's down with marijuana, especially right brain, with the ability to abstract, the ability to really create. You're actually more creative without it. You're a little more inhibited, but yeah.
So you talked about cannabinoid hypertension syndrome, CHS?
Yeah.
So I had that towards the...
Closer to the mouth. It's not where it's not.
That's not.
Talk about it. No, it's not.
I had this is...
I'll repeat all the questions.
Towards the end of my smoking, I developed CHS.
Yeah.
I was throwing up really bad dry heaves, and the only thing that was getting me through was hot showers.
Mm-hmm. That's one of our recommendations.
So what can you explain more? Like, what happens? Why did I develop that? You know what I mean? I just want to get more information on that.
Yeah, it affects in the brain, obviously. You know, there are chemoreceptors in the brain, and the marijuana has become so powerful that it triggers those damn things. You know, I never experienced that, because what I smoked 40 years ago the California crops, you might as well have been smoking the lawn. It was 2%, and I was getting the 7% because I had no problems acquiring it because my sister kept marrying major marijuana distributors. So I was selling it to my medical school classmates at cost, and we never experienced that. But it was a friend that turned on me, and I started getting more and more anxiety attacks with it, not panic. And I knew they were coming, but I didn't know who they were. But the hyperemesis with the newer, more powerful forms, I mean, when I talked to the probation officers in 3 Northern California counties, when it was still illegal, he showed me the statistics that the feds had gotten by rating crops. The crops were running 8 to 26% THC. Hashish was only 19%. The current crops are 18 to 30%. And it's not hard to figure out why people are having trouble in school and hyperemesis and motor vehicle accidents.
Well, the concentrates are 60 to 70%.
Yeah, with the oils and and detoxing people. There's a number of tricks. Gabapentin has worked the best for me with people. It works for tranquilizers and alcohol. It turns out it seems to work really well. Scripps La Jolla had a study of 600 patients and found that to be successful. Question?
Studies the developing brain, how it's affected, the declining brain after, say, 60, after 55. Any studies on?
Oh, God, yes. And they're the two, older and younger. Those are the two groups we're most worried about, just like we are with COVID. It turns out we're also worried about marijuana users, because if you were not vaccinated and you were a marijuana user, you were 80% more likely to end up in the hospital during COVID, and you were 27% more likely to end up in the ICU, and then end up with complications after that. Well, New Zealand has done this study where they follow people from age 5 to age 38, where they do neuropsych tests every single year of brain function. Anybody who started before age 15, even if they'd stopped by age 19, at age 38, they still had a permanent drop in 10 points in their IQ, and they had persistent problems with executive and cognitive function. Fortunately, we're very bright and we can work around it. ADHD, they've had this surprise that there's a 23% association. It's like if you worked in the field for more than 2 weeks. We have learning disabilities, but our IQs are so damn high we can work around them. I'm a visual learner. If you tried to tell me where you lived, I wouldn't remember anything beyond the first right turn. Show me a map. If there was a television set playing next to you, I wouldn't be able to talk to you because of the distraction. And we can learn to work around it. We don't need to be on Adderall or, it's so funny. People are starting to realize they have these deficits and are coming to me, and I find out they've got a master's degree. And, what do you want me to fix? Yeah.
So suppose, I don't know how to frame the question, but somebody who's over 50, who has some illnesses going on, they're taking medications, the tangle of drugs that are prescribed for the elderly, are there, he sighs heavily, the mixture, the toxic cocktail that's happening, if you put THC into that mix.
I was just going to say that if you're older, the absolute worst thing, of all the medicines that we could possibly use in you would be THC. The accident rate is astronomically high, and injury rate, especially for the older, because we're not as agile as we once were. Our bones have become more brittle. The discs have dried out now. They're no longer rubbery. A kid falls down, they kind of bounce. That isn't what happens to older adults. So it's a very, very dangerous drug for them. They're already having some cognitive difficulties, and now we'll give them a lipophilic drug. That's not just fat here. For DOT, transportation urines, it took a month for a guy that smoked every day to drop to a level that could go back to work at FMC. The problem is 60% of my brain is white matter. White matter is myelin, specialized nerve-conducting fat. and that's where THC goes. And when I was medical director of a chemical dependency recovery hospital, the counselors kept asking me, can't you ask people to stop smoking marijuana for 2 or 3 weeks before they come in so that we can actually connect with them?
Just curious about the relationship between addiction and dopamine. Is that a big factor?
Yeah.
Can you talk a little bit about endocannabinoids?
Wow. The endocannabinoid system becomes another entire discussion. Alcohol complexes with dopamine to produce artificial endorphins, because our real disease is about endorphins. The problem with artificial endorphins is they set up competitive inhibition. Natural endorphins don't do that. Natural endorphins you get from laughter, from lovemaking, from eating a large meal, from something happening nice to our grandkids. Those endorphins don't create any kind of competitive inhibitions. Artificial ones, if I took it long enough, my brain would get the message, we don't need to make any endorphins. That's why people that we put on opiates, after 6 months, their pain levels have gone from 4 out of 10 to 6 out of 10. Because they're tolerant of the medicines and they've suppressed their natural endorphins out of existence. The real state-of-the-art pain programs are taking all people off opiates after 6 months because of that phenomenon. Raising the endocannabinoid system raises a question about CBD, which raises the whole question about anything over the counter. Don't trust it ever. Don't trust anything you see on the internet or hear, because there are no requirements for anything to be the truth. Mayo Clinic years ago picked up, the first time we realized it, we thought the feds were, the FDA was monitoring over the counters. If you're on lisinopril blood pressure and pill, and it's 5 milligrams a day, it's 5 milligrams a day, even if it's generic. It's not 4.8, it's not 5.1. They'll shut down production. We've run out of prescription drugs at Good Sam because of problems with the production line that was being monitored. Well, Mayo Clinic picked up every sample of DHEA they could find. And the amount in the bottles varied from 10% to 150% of what was on the label. They started looking at CBD. Every single time the amount of CBD was overestimated and the amount of THC was major underestimated. Almost all of the CBD you'll find anywhere is going to have THC. And we don't know what it's going to do yet. We really don't. The claims have not been supported by research. The kind of research we need is, 10,000 people on something where 5,000 are on a placebo and 5,000 are on the CBD, and neither the patients nor the researchers know which group is which, and we see what happens to them. Because 30% of humans will get better with placebo. Animals don't do that. We're interesting.
One last question, Jerry.
One last question. Your hand was up first.
There's a new product out called Delta 8 that you can get at smoke shops. You only have to be 18. Can you talk about that, Delta 8 versus Delta 9, which is normal weed?
Yeah. Probably not a good idea.
All right, let's have a big round of applause for Jerry. Thank you. Thanks for